Thank you, everybody. Just wanted to update you on the latest numbers in the state of California. We'll walk through a little bit of what's going on down in Oakland as it relates to the Grand Princess, talk about some of the new guidelines and protocols we've advanced with our school districts and employers, talk a little bit more about testing, where we are as a state, and answer any questions that you have. The current number of positive Californians totals 157. That number is 24 more than it was just yesterday, roughly 15% greater. We currently, as you have all reported, we had our second COVID-19 related death in the state of California, in Santa Clara County. First one, of course, a number of days ago in Placer County. We still are monitoring the 1,540 individuals that came off the Grand Princess after its first voyage down to Mexico, back to San Francisco. 12 individuals of those 1,540 have been identified as positive. It's important to note, as it relates to that cohort, that they are now past that 14-day period. That is not in and of itself reassuring, but it gives you a sense of how we, from an epidemiology perspective, looking to monitor those individuals. Speaking of monitoring, we are still monitoring 10,300 individuals that came in on commercial flights throughout the state of California in 49 health jurisdictions. That's broad strokes. As you know, yesterday, some 407 passengers came off the Grand Princess. 149 Californians went up to Travis Air Force Base. We had a number of others that were repatriated in Canada, some 232 Canadians. Of those 407, we had 26 individuals that went to regional hospitals in 6 different counties in the state. What was encouraging is not all of them needed hospital care, and a number of them are now being located to appropriate sites that are being secured. Those sites include hotels and motels throughout the state. I can talk more about where those are located, talk to you about the protocols and procedures related to how we are organizing those resources and those individuals. But that is broad strokes what happened yesterday. As of 1 o'clock today, we have been successful in moving 269 additional individuals off the Grand Princess. 171 came in 4 buses up to Travis, and 3 buses were assembled and brought to the tarmac for a flight, or maybe multiple. We're figuring out exact logistics. Those flights have not taken off, but there are 98 individuals that will be heading to Laughlin in Texas. So 269 as of 1:03 this afternoon are off the boat. We continue the protocols and process to get the rest of Californians off with priority. Of course, the most acute first, Californians second, and non-Californians that will be secured either in Laughlin or in Dobbins Air Force Base in Georgia, or on our own Air Force bases as needed as they're processed into potentially 24 states. I'll remind you, we have 54 countries represented on the boat, and that includes the crew, 24 states represented on that ship. So from a logistics perspective, what they're trying to do is send people closer, to the extent possible, to their home state, and that's why the determination between Texas and or Georgia is being considered. Texas, I think, is softening its position. I'm certainly hopeful of that, and one can confirm that, but we're told they're softening a little bit on just taking Texas residents. Certainly our point of view that as Americans, we all should do our fair share, and I'm grateful that Laughlin is being opened up in Texas, but we hope they can broaden to help with logistical operation here in the state of California to ease our efforts in the state. So that's currently where we are in the Grand Princess, and again, I'm happy to answer detailed questions about where we hope to be going over the course of the next number of hours through the rest of the day and over the course of the next day or two of that operation. But first, I want to go through a number of other issues. Testing is top of mind in the state of California. We've tested 1,075 individuals as of this morning. We have currently in our 18 labs, we currently have 18 labs that are processing tests throughout the state of California. We have 7,675 tests that are available throughout that system. We have a 19th lab that just received the test but hasn't begun the process of those diagnostics, but will be shortly. In addition to that, as it's been reported, we have our first commercial testing that now is taking place in the state of California. Quest in San Juan Capistrano conducted roughly 100 tests yesterday. They have the capacity to do substantially more and will over the course of the next days and weeks. Just that lab alone, that Quest lab, we estimate some 1,200 tests can be processed. But that is one of 3 labs that Quest will be operating in the state of California. I think West Hills was another one of the labs that will be coming online, and Sacramento lab, Quest lab, will also be coming online. When those 2 labs come online, in addition to San Juan Capistrano and the 1,200 tests they can process there, we will have the capacity on a daily basis, just in Quest commercial support in the state of California, to process in excess of 5,000 tests on a daily basis. As much as 5,500, but in that range, 5,000 to 5,500. Those other 2 labs, the other 2 Quest labs, we anticipate being open in a few weeks. We have a rough estimate of March 24th, but I want to just caution you that we have a rough estimate of March 24th. They have automation capacity that requires support, and I don't want to get in too many details here, but they've got to get some support from Roche, another manufacturer. Once they get approvals, they will be able to package these fully automated labs, and we believe, again, that will be happening by March 24th. So by roughly March 24th, we'll have the capacity to test over 5,000 individuals just in those labs. If that indeed occurs, and we are within that, we certainly have that expectation, that will allow us to conduct differently our lab diagnostics and testing, where we'll do more complicated tests and we'll do more community surveillance. We'll begin to shift that burden a little bit from our own labs and broaden that burden to our commercial private partners as well as our hospitals. And it should be noted that currently 2 hospitals in the state system are doing their own tests. And we anticipate over the course of the next few days, some of our academic medical institutions will also be conducting tests. So I'll repeat, you've got our state labs, 18 that are currently conducting tests, 7,675 tests within that system. You have 2 hospitals in the state that are currently conducting tests, and we have Quest that is conducting tests at 1 lab, San Juan Capistrano, and will be expanding their capacity as the hospital system will expand theirs as well. I will happily answer questions related to testing protocols and some next steps we have in mind, including the prospect of centralizing our community testing capacity, which is the next iteration of our testing protocols, and also orient you around some of the issues of testing that continue to create stress, both from public's understanding of the testing protocols and also in our capacity to deliver on the expectation that those tests are being conducted in a timely manner. I met yesterday with all 58 county superintendents in our public education system I met with our big 13 mayors as well yesterday, talking about their needs and expectations. As you know, last Saturday, we laid out specific strategies and protocols and guidelines for our public education system, including our charter schools, our private institutions, and our institutions of higher learning. We discussed those. We discussed some of the unique characteristics that exist in each part of our state. We discussed the prospects of school closures, but what that means, issues for low-income students, the issues and pressures on those communities to deliver meals and to deliver in a safe way the needs of the broader community, particularly for those parents that need to provide for caregiving and don't have the capacity to leave work. That may be hourly employees or others that don't have savings, and the stresses this could create more broadly to the community. And I'm happy, again, to answer any questions as it relates to what those recommendations and guidelines are and the feedback we received from our public education partners. Final point, we continue to work very collaboratively with the administration, CDC, HSS, and with the Vice President's task force. As in addition to that, we're also working very collaboratively with other governors throughout the United States that are offering insight, best practices, and sharing information in real time as we iterate and move into the next level around the issue of COVID-19. So that is an overview broadly of where we are, and I'm happy to answer any questions about next steps, again, on testing, what I think will happen with social distancing, what has already happened in Santa Clara County as of yesterday as it relates to guidance related to large events, where we anticipate being there, our capacity as a healthcare delivery system to meet the needs of those that may test positive, and of course to deal situationally and quite substantively with the next few days of moving people off the Grand Princess and getting that Grand Princess back out or rather back out into sea. So happy to answer any questions.
A number of questions on mainly on the crew of the cruise ship. I'm not sure who's best able to, but why are they being kept on board if it wasn't deemed safe for the passengers? Are they being separated? Where is it going to be taken? And as far as getting the passengers off, they were kept together. Was that deemed safe in some fashion there?
Yeah, the crew, there's 1,113 crew members. Disproportionate number of them are from overseas. We are working with the consulates, consul generals, and others, and our foreign counterparts, the State Department, about the prospect of repatriating members of the crew. But the crew are staying on board to make sure the passengers are secured and to make sure that they have the capacity, once the passengers are processed, off-boarded, not only California residents, but non-California residents and foreigners, not just the Canadians, of which 232 were repatriated in Canada, but other foreigners are repatriated in their home countries, to make sure that they can move that boat out, they can operate that boat, and they can get that boat safely out to sea. As you know, we had original 21 tests positive. 19 of them were crew members. 2 were individual passengers. Of the 2,421 passengers, we are processing those 2 individuals. We processed them yesterday with priority because they tested positive. They're part of that 26 individual cohort that was sent out into 6 different counties for support and care yesterday. As it relates to the protocols of how we process individuals, as I noted, those most in need first, Californians second, non-Californians third, and ultimately we'll deal with the crew. But within that are the challenges and protocols of keeping families together, which is never easy. Someone may have symptoms, someone may be asymptomatic, someone may have a loved one that wants to travel with an individual that we may deem necessary to go to a hospital to get further diagnostics. Consequences of that are difficult, so we're in real time trying to figure those protocols out. Some of those have been written about. Some of those are heartwarming stories. They're human stories, and we have to make decisions in real time of how we conduct and process those. But we're trying to keep families together. That's a top priority for all of us. and working within the healthcare system to do that in a safe and secure manner. We're also trying to alleviate the stress, and I will acknowledge this. All 26 individuals didn't need to go to the hospital. In many respects, that's a good thing, because the worst thing we could have done is not send people to the hospital and then found out later they should have been sent. In this case, through an abundance of caution, they were sent, and not everybody needed to be in the acute environment. That's good news, which means we can then move them. But for those individuals, they had preferred not to have that first step. Now we're moving them to multiple locations. We are securing hotels and motels in multiple sites throughout the state of California. I've been working on this process for the last week or so since we first anticipated the ship arrival into Northern California. Those include sites in Monterey County, State Park, that we have secured 8 rooms for individuals that are in the Santa Clara system that were sent yesterday. We have sites in and around Burlingame and San Carlos that are safe and secure, sites that are quarantined, where there's no community engagement. Again, these are people that don't need to be in a hospital, but will be sent here anyway for an abundance of caution to complete their quarantine period. These are the folks that are not being quarantined for the 14 days on the military sites. Again, Travis being the only site currently we have sent individuals for quarantine. Miramar will be the next site where we'll begin to process people in Southern California, closer to San Diego. So that gives you a sense of some of the geographic areas of where people are. We have deeply well-established protocols as it relates to not only, again, securing those facilities, but making sure that the staff support and the medical support has the appropriate protective gear, and that people are processed in a very orderly and deliberative manner.
So to follow up, though, that begs the question of, if we're doing all that for the passengers, why not something similar for the crew? Why are they being kept in those close quarters?
Well, we're getting to the crew. We're going to take care of everybody in need. And to the extent anybody, regardless of whether or not they're passengers or crew, were in need of emergency care and acute care, they are being provided that. To the extent they're not, we are prioritizing, I'll repeat, those with most medical need, regardless of who they are, California residents, non-California residents, including foreigners, and then processing the protocols on the crew. And as I noted, originally, the expectation was all 1,113 crew members would be quarantined on the ship, and the ship would then be moored off the coast. That now is being reconsidered in this context, that there's the prospect that a number of those crew members will be repatriated. That's a work in progress with the State Department and with those foreign governments. And to the extent I have more information on that, I'll let you know. But no one has the details beyond what I've expressed, because those are current negotiations and conversations.
Governor, in the state of California, we rely heavily on our county public health officials to make decisions for their own communities. And as we're shifting to social distancing measures, I'm curious if you think that's the best method, or if the state should have more control in terms of what we're doing overall.
Many parts, one body. I mean, we're a nation state. This is not a small, isolated state. The state of California, 40 million strong, 58 counties, 480 plus or minus cities, local jurisdictions, school districts, county superintendents, local superintendents, independent school boards. So what we're doing is a bottom-up process, not a top-down process. We're providing guidance in concert and collaboration with the federal government, and we are sending that down. But we are also trying to standardize the guidance and standardize the protocols. And as a consequence, we have been in constant contact with local health officials, conference calls with healthcare providers, not just traditional hospitals in the hospital system, but community-based care, those with developmental disabilities and the like, and obviously with the school districts proper. And we are looking for first, and you'll see that in the protocols we set forth on Saturday, you'll see gradation and protocols. There's 4 different variants, and those variants all include local healthcare interfacing, so that we get the local frame first before it's fed into the statewide system. But we certainly have strong opinions around how we should standardize that delivery system. We have pandemic plans that include the aggregate of the sum total of all of our assets throughout the state, but each and every county is experiencing different set of circumstances on the ground. For example, Santa Clara County, it was identified in the federal report that came out, there were 4 states that were identified as particular areas of concern around community spread. The only area in the state of California identified by the CDC in the current variant of that report was the county of Santa Clara. So Santa Clara's protocols are going to be quite different than other parts of the state that have no community spread and have a different set of criteria and conditions. That's why we haven't set forth, and as example, to have all 6 million of our public school students be sent back home, because in each and every district, each and every county, conditions are different. That also includes social distancing more broadly defined, not just with our public education, private education, or higher education system, but also with large events. Santa Clara, I thought wisely, last night advised social distancing for crowds larger than 1,000. I think it's inevitable. You're going to hear a lot more from other counties and communities advancing the same, and we are working in concert, advising, counseling. We put out guidance on social distancing, and we are advising many of those counties, and they are being very collaborative in terms of accessing the state expertise.
As a follow-up on that, because you mentioned Santa Clara, we saw in New York State where they sent in the National Guard to a community that was just inundated, right? And I'm curious what you're thinking about in terms of using the National Guard in Santa Clara and what your calculation is.
We're not there yet. I mean, this is a dynamic process, but I can assure you we're not there yet. I'm well-equipped. Every California is well-equipped of the incredible capacity of our Guard. They've been aiding and advancing our wildfire suppression efforts. As you know, I pulled a number of them off the border for what I thought was a political mission and moved them to help us with vegetation and forest management. They've been incredibly instrumental in not only prevention, but also some remarkable collaboration around suppression in the state. We have second to none, the best guardsmen in the United States. I would argue some of the most highly qualified individuals any jurisdiction in the world. But right now, we have no identified need to utilize them.
To what extent are those local officials looking to the federal government for guidance, and do you get the sense they feel they're getting clear enough guidance from the federal government?
I think it really is a bottom-up frame. I think you go local, you work with your regional partners, your relationships, and then you link into the state. And I think the state really is point in that respect. As it relates to the operations on the Grand Princess, that's different. That's through this framework called ASPR, which is under the HSS agency, and that's in partnership with CDC. They're leading that mission with the support of the state. But as it relates to local decisions, we localize those decision-making trees, and then we work hand in glove with the state providing the kind of guidance that we benefit from our analysis on the ground of other counties, but also our daily interaction. And I say daily, almost hourly interaction with the federal government that is also advising some of that.
Governor, how are you feeling about the state's supplies of like emergency gear ranging from, I mean, we've talked about masks, but also I know the state used to have these giant like portable tent hospitals in its possession. Do we still have those, and what's the status of the supplies?
Well, you may recall, I was standing here a few weeks back talking about another challenge the state has, and one would appropriately refer to it as a crisis of homelessness. By the way, that is also very relevant in the novel coronavirus conversation, and we have an advisory coming out on that. In fact, just interestingly, been working on that all morning, and that will come out later, we hope either today or early tomorrow morning. But as it relates to the fundamental frame, and now I've lost my train of thought moving off the homeless, but to the broader issues of making sure, what was your question again? Forgive me.
Status of the supplies and
Yeah,
also
supplies.
the
We are amply supplied. As you know, we had the 21+ million masks that we had already stored from our previous pandemic plans and supplies. A lot of them were in cold storage, and we worked with the FDA, we worked with the CDC to avail ourselves of the utilization of those N95 masks, the higher quality masks. We have appropriate protective gear. But I will make this point, the gloves and the masks and the kind of protective gear that's required to do the kind of testing that I hope we'll be able to advance, we are monitoring that closely. And that's why I think it would be wise, and I made this point just a moment ago, on centralizing some of our community testing. We're looking to do that. Mark Galley, who's here, has been directed to put together a team that includes Kaiser, UC, Stanford University, and others. They're already organizing a framework, potentially centralize these testing hubs. That would also reduce the stress of the personal protective equipment and make sure that we have ample supplies, and also would help advance our testing protocols. We're also working with Quest to provide for the diagnostics of those community centralized tests.
Governor, you applauded Santa Clara County for shutting down these large events. The Kings have a home game a few blocks away from here tomorrow night, and Sacramento County hasn't made that same decision. They say they've given up on containment at this point, though. So I'm a little bit curious how you'd address the disconnect for Californians who are looking at these very extreme steps happening in some parts of the state while events are going on elsewhere.
I don't see it as a disconnect at all. I think the conditions are distinctive in Santa Clara, and I think the death only highlights that. And the number of cases in Santa Clara distinguishes Santa Clara. Now, Sacramento is not far behind, and I think it's in all of our interests that the Santa Clara health officials make recommendations, and we're guiding those recommendations. But you ask me, if you are asking me my personal opinion about large events like sporting events, I found it quite curious, and I mean this with respect, may not come across this way, but I found it quite curious that the four major organizations, NHL, soccer, Major League Baseball, and the NBA, put out guidelines to protect their athletes, but not their fans. And I found that curious. And I think they owe you and their fan base an answer as to why is it more important to keep you as reporters away from their players in the locker room than keeping fans in highly contagious parts of the country together. So I think it is incumbent upon not only those leagues, but I agree with you, local health officials, to assess the conditions and make those determinations. And I can assure you those will be forthcoming. I don't want to get ahead of local decisions, but you're going to be hearing a lot more, as you've been hearing, about large-scale events, concerts, tennis tournaments, and other events, including parades that are being canceled all across the country, all across the state in real time.
Are you trying to say you want these leagues to take the proactive step of canceling games or taking
I
extreme
think
measures for how
I
they
think
handle
the local health officials should make those determinations, but I think the leagues owe their fans more than just consideration of their players. I think they also should consider more broadly the public.
Governor, President Trump today said there's nothing that you've asked for that the federal government hasn't provided. Is that
Correct.
true? And how are things going?
That's correct.
Working with them?
That's correct. Just it's an accurate statement. I can lie, I can mislead you to suggest otherwise, but I'd be doing just that, misleading you and lying. But let me just tell you what, if we're going to continue that streak of collaboration and cooperation, here's what they need to do next. We need, and you need to, I think all of us in the public need to understand this, and I think we can use your support here as members of the press. Testing kits are not a test. There's a lot of misinformation or lack of information. I don't even think it's misinformation. I think people are just unaware. Many of these test kits are like printers, but without ink. The test kits don't include all the components to test. You need reagents. It's more their language and their expertise than mine, but you need other components to ultimately test. That's the disconnect. So what you're hearing from the administration, what you've heard from us, we have 7,675 tests available, but not every one of those tests can be accessed because all the ingredients are not available at all of the labs. By the way, the ingredients are not just reagents, they also are personnel. And so all of those things are compounding the communication challenge, I think not only the administration's having, but everybody's having, about why it is that some people are claiming they have tests, but then you talk to local officials say, well, we don't. So here's what we're doing. Not only have we been very aggressive with the CDC demanding that the reagents be part of the support network, not just the test kits themselves, but also we're working with our private commercial partners, for example, Quest, to deal with any of the backlogs that we have in the state. By an estimate of a few hours ago, we have anywhere from 180 to 200 on the high end tests that are backlogged that Quest is committed to helping us process. So that's, I know, offering more questions for you than answers, but I think this is an incredibly important part of the national conversation that we have not had on the testing protocol. The test kits are not an entire test. And people need to know that, and I think that it would be very helpful if our task force, national task force, communicates that with more clarity so that we at the local level can do the same for people trying to access those tests.
Governor, on those hotels that you mentioned and motels that the state is using, are they facilities or hotels where other guests are staying?
No, 100%. No one else is in these. You're going to have hotels with just a handful of people that are completely empty in other parts of the hotel. These are 100% secured, 100% segregated from the general public, secured not only as relates to security, but secured from protocol perspective, processing perspective, personal protective gear perspective, medical overlay perspective. These are perhaps some of the most safe sites in the community because of all of these additional protocols. And remember, these are not people that are symptomatic that need to be in the hospital. These are people that we're just monitoring through the incubation process that went into the hospital system first and were determined not to be needed, rather didn't need to stay in those hospitals. And again, our biggest focus right now is to keep people out of the acute care facilities that don't need to be in there so that we can provide access, not just for COVID-19 patients, but for the broader panoply of issues that we face on a daily basis, including the flu season.
So why aren't they at the Air Force bases?
They were processed off the boat in the priority that I established a moment ago, where we triaged the passengers, prioritized those that we felt were most in need medically, and they were processed as most in need medically. Let me give you an example. An elderly woman in a walker that people weren't sure, and they had tested. She wasn't necessarily, didn't have a fever, but she would be in a high concern category, and they felt there an abundance of caution to send her, as an example, to a hospital. Hospital comes in, says she's perfectly fine, she doesn't need to be here. Everyone's relieved by that, but now she's not in the bus to Travis or to Laughlin, and now we want to bring her into a community setting that's more appropriate because she still may develop needs because she is in a position that's particularly vulnerable. And so we're trying to segregate people along those lines. This is just deep common sense and an abundance of caution. And sometimes in abundance of caution, you overcorrect. And I would say one of the protocols as of yesterday that will be improved is that triaging of those patients so we don't burden the hospital system. I think there was I don't want to say, there was a little concern with some of the hospital folks saying, wait, we have patients, but these are not people in acute condition. Again, thankfully, that was not the case, and we wanted to secure those hospital administrators were worried that we were going to see multiples of more individuals, so we've improved those protocols. Number two, we also have another protocol we need to improve, and that's self-evident. Many of you have cell phone numbers and Skype, and you're zooming in and talking to passengers on the boat, and they want to hear folks talk to them in real time. And to the extent they're listening to this, let me deeply empathize with those passengers because they're watching the news, they're listening to the captain, they're not necessarily familiar in real time what's happening on the ground. That creates anxiety and stress. They don't know where they're going. Am I going to stay in California? Am I flying to Georgia? Am I flying to Texas? Am I ever going to get back home overseas? And so we are improving those protocols. It was a big part of our early morning readout, sort of our after action reporting from yesterday to improve real-time communication today. Trust me when I say this, that's a work in progress. but we're trying to get the captain to communicate more real-time information, and we're trying to provide that information up the chain to the captain so that those passengers who are deeply anxious and all they want to go is not just be healthy, but get home, be with their loved ones, know when that will happen. And so that's being improved in real time as well.
And along that line, any estimated timeline for getting them all off? Do you have a further breakdown on which other countries they came from? And will they have to do the full 14-day quarantine if they've already been isolated for just a week on the boat?
No, there's no time served, so to speak, in your cabin. It's 14 days from point of demarcation, in this case, for the California residents disproportionately to date, and to Travis. Those will go down to Miramar, Laughlin, then the 14-day process begins. Number two, as it relates to number of countries, I mentioned, or rather referenced 54 countries, 24 states. We are assessing the exact locations or how the numbers that are attached to those locations. The vast majority were Canadians, the 232 I mentioned today, number from the UK, and then of course the passengers, or rather the crew members, disproportionate number from the Philippines and then other parts of the globe. And that's the State Department's job and responsibility role with our consul generals and others, Foreign Service folks to address those needs.
Some of those passengers are sharing letters with us that say the quarantine will be reassessed after 72 hours. Is there a change in protocol there?
Yeah, well, I don't know. I can't refer to the letter. I have to take a look at that.
Can you talk to us a little bit about the masks that the state has in its reserves? How many of those have gone out, and how are you prioritizing where they go?
Yeah, well, we have 21 million. Where have they gone?
So they're made available to the health systems that are requesting them. Additionally, as the governor mentioned, that as we shift our own protocols, the idea of how we test, we're expecting that each health system's sort of use rate might be slightly reduced so we can rationalize the distribution to the most needy areas. And as we get increasing need from community-based providers, we are continuing to ask for reserve or orders. We have other hundreds of thousands of other masks on orders, so we're trying to keep up with that demand. But so far, we've been able to distribute them to locations that have needed them.
These are healthcare facilities
Largely hospitals.
We know that obviously there's standards for contractors and right, so that their employees have to use masks so they're not inhaling drywalls and other things like that. How do you also meet those needs when obviously we're seeing a shortage of these kind of masks?
So as different areas of our sort of economy and business practices need masks, we're open to receiving those needs and requests, but so far our focus has been largely on the healthcare delivery system, hospitals, clinics, and other areas.
And I'm also curious for you, knowing that we had cases of this, in December in China and other places, when do you think realistically the virus could have spread to California? We obviously know when the first confirmed cases are, but when you're thinking about how this could have spread in the community over time, how long do you think it's been here?
I mean, it's hard to know. We have been busy on repatriation sites, working on surveillance at our airport since January. So certainly it could have been at that time. We know that the transmission of the virus, there's an incubation period anywhere from a few days up to 14 days. So we aren't exactly certain when it first came into California, but we know that our surveillance systems, our home monitoring approaches have allowed us to early on identify the most serious cases. And as we move sort of through the progression of coronavirus across the state, that we'll have a chance to identify additional cases through community spread. So, I mean, our best estimate is sometime in January, but we're not exactly certain.
Governor, you talked a little bit about the sporting events. What about a smaller scale, like riding the bus, going to the movies? What do you say to Californians? Should they be worried about that?
Yeah, I mean, look, as we see more community spread and we see concentrations of community spread, listen to your local healthcare officials. They're putting out guidance in real time, almost on every few hours. There's new guidance coming out, and we are in constant contact and collaborating with those agencies to provide counsel. And I would take those seriously. Look, the common sense is self-evident. I think everybody recognizes if you have a senior at home, if you're taking care of a grandparent, you should act as if you have the virus, meaning you need to conduct yourself in a way that protects our elderly, those with underlying conditions, broad strokes, pre-existing conditions, heart disease, and other related issues. And I think those guidelines are wise, and I think that's why we're disproportionately focused. We didn't talk today, as we have on multiple previous occasions, about health care for our seniors at the assisted living facilities, our nursing homes. That's a top priority for us as it relates to protocols on sanitation, isolation protocols, and the like. But look, we want to make sure that our seniors are protected, and they're our top priority. And so to the extent we can avoid large social interaction with our senior community, that would be the top priority broadly, and then more substantively and strategically in these communities that have been impacted by community spread.
Governor, your worst-case scenario, like Italy locking itself down, do we have that yet?
Yeah, we have planning. You have all kinds, we have pandemic plans. They're the kind of plans that keep you up at night. And they've been in place for a long time, going back many, many administrations. So you can imagine when we run tabletop exercises, and we have at our SOC, our State Operations Center, which is at its highest level, for no other reason than just to coordinate all of our human resources and state assets under one roof. We've been running scenario plans. Just as an example, on Friday, we had over 100 agency directors, department heads, and key personnel throughout the state of California. We ran scenarios on the worst case spread analysis, on moderate, best case, and what that would do in terms of stretching our resources, what it would do not only from a public health perspective, but a public safety perspective. Those protocols included how you take care of schools in terms of meals that need. Just remember, 60% of our kids are on reduced or free lunch. You go up to the Merced, they're at 80%. So that's making this point. 80% of Merced is a different conversation than 60% in the aggregate. We don't live in the aggregate. So everything has to be designed with localized frame of reference. So our pandemic planning operates accordingly. So you hear numbers in the aggregate, it doesn't tell the real story, the granular nature of the reality as this spreads throughout the state and throughout the country. But no, we have those, and I'm not resigned to a fate undetermined. We are prepared for whatever comes at us, and we're trying to mitigate and manage things. It's decisions, not just conditions, that determine our fate and future. Society becomes how we behave. We are our behaviors, collectively and individually, and all of us have a role to play, sort of meet this moment, to protect themselves, to protect their loved ones, to use common sense. And these large events, seemingly in areas where you have community spread, I think it's appropriate to begin the process of social distancing. And I think at these large music venues, you're already seeing that happening. Large parades, you're seeing that happening. And I think it's inevitable you're going to start seeing that with large sporting events as well. Oh, I'm sorry.
Governor, can you talk about your conversation with the superintendents yesterday, specifically LAUSD and other SoCal schools?
Yeah, each district has their own unique set of concerns, and then there are broad strokes concerns that connect each and every one of us. But LA in particular, there was expressed concern around the issues of closure and impacts to low-income students, particularly in mixed status families, particularly in relationship to the federal public charge that's impacting already the access and availability of federal support, the impact of food stamp decisions in this country that are impacting those families today. Those impacts would be exacerbated, made worse with a school closure and the inability to access not just one, but two meals, breakfast and lunch. So we talked in terms of what does it look like if one of the schools close, the entire system close? How do you provide access to those meals? Do we do it at libraries? Do we do it at parks? Do we have an online component? But what do you do with those that don't have the capacity to do it online? How is that organized and distributed? But immigrant overlays were a big part of the specific conversation we were having in Los Angeles District. Yeah, I've been spending most of my time at the Operations Center. So this is probably the longest I have not been on a flight, which is 3 days. But I would not personally have real concerns, but if I had grandparents, I would for them. And I expressed that. I don't think people should be on cruise ships that are elderly. I don't think anyone, regardless of their age, with an underlying health condition should be on a cruise ship. I don't think people should be running out to, high five one another and hug strangers, as we often do at large sporting events if you have an underlying health condition or you're elderly. I don't think that's wise. I think, again, that's just common sense. That's not hysteria. And there's formal guidelines being processed, county by county, state by state, and just anticipate that's the next iteration of this. The numbers will start growing. I mentioned today we're up 15% from yesterday. That number will grow, and you're going to start getting into multiples where it's likely you're not even going to report what we're announcing today, which is 157, because a week or so ago it was just a handful. It's going to be multiples of that as we do more testing. That's inevitable, that you're going to capture more. And that could be a very comforting thing. We don't know what the numerator is. The more we test, gives us a better sense of what this really looks like. That's why the testing protocols are so critical, and it's so, I just want to reinforce, so important that we're honest with the American people about what these test kits are and what they're not. They're one component that requires other components. When we separate from the commercial labs, that's a significant issue. The commercial labs will mitigate and mollify that substantively because they have more automated technology, but it is something that I think goes to explain some of the disconnect you're hearing. We know how many people we've tested today. Again, it's 1,075 in California, but we just added 2 hospitals, and we're going to start adding the private clinics, and we're going to start adding other academic and other research facilities. That will then create a lag in the reporting, and I just want to warn you of that. Because right now the current protocol is if you test positive, the hospitals tell you every 14 days. We're now working with the Hospital Association yesterday to see if we can come up with new protocols, but those are the existing pandemic protocols. We're going to come up with new protocols. We're already working with Quest to request that they provide real-time data on the number of tests. Yesterday they did 100 tests. Yesterday they have capacity at just San Juan Capistrano of 1,200 tests. So when you have more testing sites, that's a collection process. It's a little more challenging than me just saying in our 18 labs, we've tested 1,075 people. And then you have the additional burden that the CDC will have of taking local, private, community tests, and then beginning to put those state numbers together and then aggregate those so they can provide those nationally. So it's going to become an even more challenging thing, but the bottom line is we need more tests. Yeah, that was what I was referring to, and forgive me, I got, my mind went to this press release that we're putting out, which is not a press release, it's really the protocols and procedures. We've been working with cities large and small. We talked to the big 13 mayors yesterday, substantively about homeless issues, their concerns about the novel coronavirus, COVID-19, and its impact on their most vulnerable residents, which disproportionately are the people that are already struggling with bipolar disorder, schizophrenia, paranoia, many of them self-medicating, drug or alcohol addictions, and other related issues. And flu season is very impactful, obviously, in populations out in the streets and sidewalks. And so we are coming up with protocols as it relates to sanitary strategies, isolation strategies in our shelters, our supportive housing centers, our drop-in facilities, and putting those guidelines out in the next number of hours.
Are all the passengers going to be tested for the virus, and they were brought off in groups?
Yes.
Is there a concern about that, that if they weren't, they've been quarantined on board, brought off in groups? Is there
Well, they're
concern
brought
about
off
the next-
in very deliberative way. They're brought up in small groups, cohorts. They all have protective gear on. We're very sensitive. Obviously, the bus drivers have the appropriate protective gear. A big part of the processing and protocols that we've been working on the last few days, we're preparing the sites, securing the sites, protecting workers as our top priority. That's why even after the cruise ship docked yesterday, there was a couple-hour lag just to make sure that we had secured the workers and those protocols. But those protocols include the passengers as well. They'll be tested at Travis, they'll be tested at Laughlin, they'll be tested at Miramar, they'll be tested at Dobbins, they'll be tested where they end up through that protocol process of quarantine, which will initiate that 14-day scoping.
Does the state have the ability to restrict cruise travel in and out of California?
We have our legal team reviewing that. We've made it clear to the task force, the vice president, of our concerns. As you know, those concerns were reinforced in the last 72 hours, where you had 2 cruise ships in Southern California, one near Long Beach, one near Los Angeles. We had a crew member that was on one of the previous cruises, the Grand Princess cruise, ended up on this other cruise ship. They needed to be tested. They came back negative, and that allowed that ship to set sail. We obviously are concerned about all the other ships that are off our coast that are quote-unquote berthed in the state of California, even if they're not flagged in the state of California. I imagine, and I assure you, the governor of Florida and others are looking at the same. We are looking for clarity, as you heard last night, and I just been sidetracked today with the processing and protocols related to the Grand Princess. But the vice president assured all the governors yesterday in a conference call, and then during his press conference, that he has new guidelines as it relates to the cruise ship industry that he's going to be making public. He was in the receipt of those guidelines this morning, I believe, and he will be processing those. We're eager to hear what those protocols are, but I cannot be more clear in terms of what I believe as governor of the state of California, the largest state in the nation, the 5th largest economy on planet Earth, that it is incumbent upon seniors and those with any medical conditions not to go on cruise ships and to begin to socially isolate themselves from larger crowds. It's just common sense. And the cruise ship industry owes it to their own self-interest to, I think, advance very aggressive protocols and new requirements at peril of that industry collapsing.
That's kind of a follow-up on that. Can you just quickly explain what the state's role is in the cruise ships of cars where we've had problems? Like, where does the state's control end? Where does the federal government pick up?
Well, 12 miles off the coast, international waters, and then we're in the United States waters. 3 miles off the coast, we're in California waters. As you know, the ports are in trust, but in trust local administration. So you have localized ports that have port commissions, typically appointed port commissioners, but state lands, 3-member body, oversees those ports. The reason I bring that up is the State Lands Commission has authority that can offer a little more, elbow in sort of introducing its own considerations and thoughts. It's chaired every other year by controller and the lieutenant governor and member of my finance team. So there's influence there by the elected officials in the state. But as it relates to the cruise ship industry, there tend to be foreign flagged, which is an issue as it relates to these ships coming on active military sites, which there are protocols that distinguish between American flag ships and non-American flag ships that cannot port at active military bases, that restricted, for example, our ability to dock the current Grand Princess to a certain smaller number of locations. That's why it's in the Oakland, among one of the reasons it's in the Oakland port. But we are reviewing our legal authority to hold these things at bay. But the Coast Guard is the predominant point of influence. And the bar pilots, of which myself and others appoint members of the bar pilots, we have some additional oversight when these come closer to shore, as the bar pilots then take over the operation of these. And then you have union issues. The ILWU, Longshoremen's Union, also have strong influence. So it's, forgive me for belaboring this, it's complicated. And it's a way of saying the complication is not that complicated, just multi-layered, I should say. And we're getting some clarity on where the real fist of legal authority comes.
When it comes to taking people off those boats who've been potentially contaminated or people who are sick, who is in control of that? Who's making the call?
The federal government through ASPR protocols and CDC. They're running this operation and the protocols, but in concert with the state of California, our public health officials and local officials, be it the port and be it the members of the city itself, Mayor Libby Schaaf and her team, and the county, Alameda County, and their health directors. So it's a real partnership, but the direct line of authority is ASPR under HSS, CDC. They are the ones on board. They are the ones moving this protocol. Let me just make this point. The current process, and this goes to your question, you had a 3-part question. I got to 2 of the 3. Let me get to the final part. At the current processing, we're going to be behind. So we want to see that processing stepped up. We're trying to get to about 100 people every hour. And we want to see that happen. And so that's a work in progress. And we're just in, we have barely been in 24-hour rotation of operation now. So we're getting a different cadence. I gave you the number of people that are already off, 407, 269 today, and then the 230, we went through all those numbers. But we're going to need to see an increase in those processing in order to turn this ship around. We don't want to see it here for more than a week. We want to see it here for 72 hours. But look, we're going to do what we need to do to keep people safe, keep people healthy. But we made commitments to the port. We made commitments to the mayor's office. We were given commitments and assurance by the federal government. I'm not pointing fingers. Any logistics operation with human beings, there's an element that constantly requires adjustments. And I can just assure you that we anticipate more adjustments over the course of the next 24, 48 hours.
Thoughts on the budget, what the fiscal impact from this at this point, any early estimates?
Yeah. So my budget, which I presented here a number of months ago, $222.2 billion budget. It's my opportunity to remind the rest of you and the American people that California runs surpluses. It balances budgets. We anticipated on the January budget, we had $5.6 billion budget surplus. And we projected by the first quarter of this year that the S&P would be at 3,120. It's lower than that, but it's, that was our estimate. We don't live and die by the S&P, but we are impacted by the S&P, perhaps more than many other states because of the volatility and the nature of our tax structure. So we're watching this closely. And that's the wonderful thing about our process, is we're always watching it closely, and we've always anticipated uncertainty. You remember last year's budget, close to 80% of it, one-time surpluses were used for one-time investments. We are managing conservatively, and the budget I presented in January manages conservatively. To the extent I can tighten it up with the May revise, which I go through that process in April, we will make adjustments accordingly. I feel very confident in our ability to meet this moment from a budgetary perspective, looking at the macroeconomics internationally, nationally, and in the state. But we have to look at household economics as well, and this is where I'm anxious. All of us are anxious. I'm a small business person, as you know, but with a blind trust, so I won't speak to what I don't know, which is how the businesses that I founded are faring in this economic environment. But I'm well aware of the anxiety that people in the service industry are feeling, people in the care sector are feeling, particularly about their public health, but also their hourly wages. Those that are janitors, those that work hard every single day, about a third of the population of the state of California working full-time, earning less than $15 an hour, that do not have savings, even in an economy as strong as ours has been, don't even have the ability to access a few $100s in an emergency. Those most vulnerable Californians and Americans are top of mind, and that's why I'm very encouraged by the discussions in Washington, D.C., on Capitol Hill. Been in constant communication with Speaker Pelosi's office. Our two senators talked directly to Speaker Pelosi 48 hours ago about specifics related to the $8.3 billion appropriation. But in addition to that, talked to her specifically about unemployment insurance and how she could impact some changes that allow people to access UI more quickly. It's an interesting and perverse fact. To get unemployment insurance, you have to be actively seeking work. Well, in this environment, that's a little more challenging. So we have a number of provisions that need to be waived. Also, the ability to access UI more quickly. We also are concerned about sick leave and the availability of sick leave. Of course, California, one of the best states for its requirements for not only its own employees, but also more broadly for state-run businesses. But we obviously are concerned about all of the above. I think we can do better than just a payroll tax. That's not a critique. That's not a cheap shot. I happen to personally believe, but I'm just a governor, of employment insurance, not unemployment insurance. And by the way, I have some history with this. When I was mayor of San Francisco during the economic downturn, we took a portion of the stimulus money, tens of millions of dollars, and rather than doing unemployment insurance, we subsidized directly and reimbursed employers to keep employees employed, even if they weren't at work. I think there's no more thoughtful and strategic way of addressing this crisis than considering projects along those same lines. I have shared that with a lot of our federal representatives, and it's something that I think can be done at scale here in the state of California.
Specifically healthcare workers, and maybe this question's for Dr. Angel. I'm wondering if CDPH is looking, there's been obviously concerns brought up like the nurses union and healthcare workers. I'm wondering if CDPH is looking into, making sure that training and preparedness is happening at healthcare facilities and hospitals.
We work very closely with the whole networks of providers across the state. We hold regular meetings with them to make sure that they all understand where the state is on specific policies and procedures, and to understand what their needs are in the face of this. And so through all of those conversations and those regular meetings, we are also checking in to understand where their needs are. They all have very strong infrastructures of training. And so our role in this is to support and understand if additional needs are there, and then to understand how the state might move into those spaces to support them.
But in terms of like any requests, I know the union has asked CDPH for information like on supplies and stuff that you mentioned, like masks and earlier, but I'm wondering, is that information that's being given to the unions or can be shared, or how are they working with them?
How that information can be shared with the union?
Is it being shared with them, and
We certainly put it out there, and we can explore other ways to make sure that the information goes out more broadly if there is a sense of that.
Yeah, we're working, with the nurses union, with SEIU, the principal provider of in-home supportive services for our seniors. We certainly can strengthen those lines of communication, but they are open lines of communication very directly, in fact, with the governor himself to leaders of those respective unions. We want to maintain that line of communication. Look, there was some concern around my proclamation of declaration of emergency in the state as it relates to protocols and requirements, procedures, and regulations that could loosen some of the wins that were gained by some of those respective organizations in the past, and we're working to secure that those were not intended to be diluted or diminished with that declaration. But this is, again, all part of an iterative process. I'm very proud of these guys. I've been, without their knowledge in some cases, been chiming in on those big conference calls they've been doing. 24/7. This is all they're doing, are these conference calls with every group you can imagine. And you know what? Good enough never is. There's always need to do more, strengthen those lines of communication. And so to the extent we hear specific feedback, we'll try to be responsive as we possibly can.
Governor, we've got one nursing home up in Washington State with 18 deaths in it, and obviously growing concern over those nursing homes. And I know the state is reluctant to impose any sort of top-down approach, but is there some consideration being given to the idea of restricting who goes in and out of facilities like that, given the higher mortality rate for older and infirm?
We've been very clear, and we've been very proactive in setting forth guidelines and working throughout the system to be very clear as it relates to protocols related to visitors, protocols related to quickly and immediately isolating any individuals that are showing symptoms, are symptomatic, or are tested positive, so that they're not sitting around those facilities. So the answer is unequivocal, yes, and we've been proactive in that respect. We've also been organizing for weeks now very detailed conversations. One of the largest providers we were just talking about owns 90-plus facilities, even trying to personalize some of those concerns because of the scale and scope of his operations. So I can assure you, as I said a moment ago, that's one of our top priorities.
The New York Times is quoting American Healthcare Association calling for no family visits.
Yeah, and that's in the spirit. That's in the spirit. And this is exactly, look, I said what I said a moment ago intentionally as it relates to individuals that may not even be in these congregate settings, in assisted living facilities, and skilled nursing facilities, in group homes. And by the way, it's not just seniors, disability community, and the like, both cognitive and physical, that we should treat. If you have, and many people, I was taking care of my father, my sister and others, families, take care of your kids, take care of your fathers, dementia care. You got to act as if. And accordingly, you need to make sure even within your household, if people are home quarantined, when there's 7 or 8 people running around means something very different than home quarantine when you're a single adult. And so home quarantine needs to be nuanced as well, and it's along those same lines of protocols. That kid that may still be going to school, when he runs home to kiss grandpa, doesn't sneeze on grandpa, and, just make sure we're using common sense along those lines, and so it extends even beyond these facilities. But these facilities are top of mind of concern.
Governor, how has this affected your administration, your senior staff? Have you taken any precautions? And are you concerned about the impact that this epidemic, I guess we can call it now, may have on the legislature, on the functions of state government, on state agencies, CHP, Caltrans,
Yeah.
environmental?
Of course. I mean, yeah, of course. Be misleading you if I wasn't concerned about all of the above. I care deeply about the legislature, not only as a body, but individually. So many of them have loved ones, family members. I care about their health. I don't care about their party affiliation. I care about my team's health. And so I also, we're monitoring all of that. We're looking at distance as it relates to our own protocols and procedures. Look, the whole point is to, and this is a mantra in our office, and I think it should be a mantra for everybody more publicly. We want to maximize the disruption for non-essential events so we can minimize the impact of essential functions and events. I could repeat that, but it's important to get the gist of that. What's non-essential should be non-essential at this moment so that we can minimize the impacts, the things that are essential. And I think that not just from public safety perspective and public health perspective as it relates to large events and venues, but as it relates to functions of government. So you specifically brought up the CHP. I think of the DMV. I'm thinking of our capacity to telecommute, but our IT capacity, which is being assessed in real time. We have CalHR working to look at those protocols. CalPERS has already moved forward with similar protocols on distance as it relates to the work that they're doing, but they're uniquely situated to do so. I mentioned in-home supportive services. I'm worried about that cohort of Californians where we have caregivers, many of them seniors themselves, taking care of other seniors with all kinds of unique challenges with socioeconomic concerns. So all of those things are, I can assure you, being assessed in real time, and we're taking them very, very seriously.
Governor, on the DMV, which you mentioned, are you worried about the influx of people who are going to be coming in for their real IDs? And
Yes.
what's the status of conversations about that?
Well, that was going to be a challenge in the perfect. I mean, that's coming up this October. You guys were ready to pounce on that, and I know that. So we made progress. You remember I stood up here during that budget presentation and said we're a lot better than we were a year and a half ago, but that's a middle of the road process point, meaning we're well underway of reforms that have a long way to go. But the real ID stress is not unique to California. I think that exists and persists, I know, in every other state in this country. It may be an opportunity for the federal government to consider, and the aggregate, the totality of that burden as it relates to how this coronavirus, this novel coronavirus spreads. We'll see. There's a sense maybe in the summer it modulates, mitigates. We see numbers start stabilizing, but big concern potentially in the fall. And so these things have coincidental time. This is October in the fall where that anxiety may increase on the need to get the real ID, but also around the time this novel virus may be coming back with some fury as well. So we'll work with the federal government on that, and we'll certainly work with our DMV field offices. By the way, those field offices are encouraging you to go online. We've already stepped up our sanitation work and protocols, not only with Purell and other, forgive me for advertising that product, but other products that individuals can access that really do need their IDs for just day-to-day functions, not just driving. But we really encourage people to go online because you could still do a lot of work, automated work, to minimize the time you may even need to be in a field office. We're not, this moment, closing down any field offices, but this moment is not a moment in the future. We'll have to assess that in real time, particularly in communities where you're seeing spread. But I encourage, we are already working, I encourage people to try to find ways to avoid long lines on the natural, but this may be a perfect opportunity at the DMV.
Governor,
Sir.
In regards to the 14-day quarantine, this is probably for the health department, recommendations change for that? Sacramento, Placer, and Yolo have stopped telling people about quarantine.
Yeah, well, I'll let them answer. We were having this conversation before we walked in.
So an individual who has been exposed to somebody who has known COVID-19 or has been to one of the countries where it's moving should be quarantined for 14 days. The reason that it's 14 days is because that's the incubation period. So from the moment that you could have been exposed, if you're going to develop it, you will develop it over the 14 days. So that's the most important time for you to stay isolated, for you to not be around other people where you might be able to pass it to others. So the 14-day quarantine is what is recommended for those who've been exposed. If you test positive, you stay isolated until you have 2 negative tests so that we know that you are completely done with the course of the infection. So it's 14 days for quarantine. If you test positive, it may be longer.
And specifically Sacramento now advising they have moved from containment to mitigation
So-
and are moving away from their original protocols.
Right. So what's very important about that is that there's a point at which taking people and quarantining them and doing what we call containment no longer is effective. So in this area where there is community spread, there's a point at which one says, this is not the best way to address the needs in our community because we're no longer containing it. We need to move to a point of mitigation. And when you move to a point of mitigation, rather than focusing all of your resources on those people, those individuals who may have come in contact with somebody who's exposed, you start thinking about using your resources more broadly and start thinking about those wraparounds, what we're talking about, focusing on approaches that help to decrease exposure in those who might get into the most trouble should they get infected. That's the point that we're getting to now, which is mitigation. That's why you're hearing this message of we're no longer focusing on quarantine, we're focusing on broader community needs. And that is the appropriate point in specific communities as it spreads.
Anybody else? So can exhaust you with questions?
Your Office of Emergency Services reached a settlement with PG&E in the bankruptcy case where they're dropping their claims
I
on.
shouldn't have asked for the last.
So, can you, are you, given your statements before and, you know, that you weren't happy with how the bankruptcy case was proceeding?
Let me,
more satisfied now?
That's a profoundly important question that will be answered Thursday. And I'll leave it at that. Thank you guys very, very much.
Man, you waited so politely for that.